If you take blood pressure pills every day, whether it's Amlodipine, Losartan, or Lisinopril, this affects you directly. Many adults over 60 take their medication exactly as prescribed, yet they still deal with dizziness, swollen ankles, tiredness, or blood pressure readings that seem to change for no clear reason. The truth is, taking the pill is only part of the picture. A few simple habits can affect how well your medication works and how you feel each day. Understanding these habits may help you avoid unnecessary side effects and get the full benefit of your treatment. My name is Dr. Harrison Blackall, and I'm a family medicine physician who has spent more than 20 years helping older adults manage heart health and blood pressure safely. On this channel, we take complex medical topics and explain them in simple, practical ways that can help you stay healthier, stronger, and more independent as you age. Before we begin, have you ever noticed a side effect after taking your blood pressure medication? If so, let us know in the comments. Your experience may help others learn what to watch for. To understand why blood pressure pills can affect people differently after age 60, it helps to know what these medications are designed to do. In simple terms, they help relax blood vessels, reduce pressure inside the arteries, or help the body remove extra fluid. Think of them as tools that make it easier for blood to move through the body without putting too much strain on the heart. As we get older, however, the body does not process medications the same way it once did. The kidneys may work more slowly, blood flow can change, and the body may hold on to less water. These changes can affect how a medication moves through the system and how strongly it works. That is one reason why the same dose that felt perfectly normal at age 50 may feel very different at age 70. A medication that once caused no problems may now lead to dizziness, fatigue, or changes in blood pressure. The hidden reason side effects become more common is that aging changes the body's ability to adjust. Small shifts in hydration, circulation, or kidney function can have a bigger impact than many people realize. Once you understand that, the next 7 habits become much easier to recognize. The first mistake is taking your blood pressure medication at different times each day. Many people take it in the morning one day, at lunch the next, and before bed on another day. The problem is that these medications work best when they have a steady routine. Research suggests that taking blood pressure medicine consistently helps maintain more stable blood pressure control. Think of it like watering a plant. Too much one day and too little the next can make it harder for the plant to thrive. The same idea applies here. Some people notice their blood pressure readings seem to rise and fall for no clear reason, when the real cause may be inconsistent timing. A simple step is to take your medication at the same time every day. However, always speak with your doctor before changing your medication schedule. The second mistake is not drinking enough water. Dehydration can make common side effects, especially dizziness, much worse. As we age, our sense of thirst often becomes weaker, making it easier to become dehydrated without realizing it. This is why some older adults feel lightheaded when they stand up from a chair or get out of bed. Staying properly hydrated can help support healthy circulation and reduce this risk. Talk with your healthcare provider about the right hydration goals for you, especially if you have heart failure or kidney disease. The third mistake is standing up too quickly. Blood pressure medications can sometimes increase a condition called orthostatic hypotension. This simply means your blood pressure drops when you move from sitting or lying down to standing. When that happens, less blood reaches the brain for a moment, and you may feel dizzy or unsteady. For older adults, this is more than an inconvenience. A fall can lead to serious injuries that may take months to recover from. Imagine getting out of bed during the night, standing up quickly, and suddenly feeling the room spin. A simple habit can help reduce this risk. Sit up first, pause for a few seconds, and then stand slowly. The fourth mistake is ignoring swollen feet and ankles. This is especially common in people who take amlodipine. The medication can cause small blood vessels to relax, allowing fluid to collect in the lower legs and feet. Mild swelling is often not dangerous, but swelling that becomes severe, appears suddenly, or is accompanied by shortness of breath should never be ignored. Think of swelling as a message from your body asking for attention. Keep track of when it happens, how severe it becomes, and whether it is getting worse. If the swelling concerns you or continues to increase, contact your doctor for guidance. The fifth mistake is mixing blood pressure medications with certain over-the-counter drugs without realizing there may be a problem. This often happens during cold and flu season. Some common cold medicines contain decongestants that can raise blood pressure and make it harder for your medication to do its job. Certain pain relievers can also interfere with blood pressure control in some people. Think of it like having two people trying to steer the same car in different directions. The result may not be what you expect. Before taking any new over-the-counter medicine, take a moment to read the label and, when possible, ask your pharmacist if it is safe to use with your blood pressure medication. The sixth mistake is assuming that fatigue is simply a normal part of aging. While it is true that energy levels can change over time, medications can sometimes play a role as well. If you feel unusually tired, weak, or less active than normal, it is worth paying attention. For example, some people notice they feel much more exhausted after starting a new medication or changing a dose. A helpful step is to keep a simple symptom journal and note when the fatigue occurs. This information can help your doctor identify possible causes. Most importantly, never stop a blood pressure medication suddenly unless your doctor tells you to do so. Now we come to the mistake that surprises many people the most. Certain foods can affect how your blood pressure medication works, yet many older adults never hear about this until a problem appears. One example is grapefruit. Grapefruit can change the way the body processes some medications, which may increase or decrease their effects. Another important issue involves potassium. Medications such as Lisinopril and Losartan can increase potassium levels in the blood. At the same time, many healthy foods, including bananas, oranges, and potatoes, contain potassium. Even more surprising, many salt substitutes are made with potassium instead of sodium. This does not mean you should avoid these foods. The real lesson is that food and medication work together, whether we realize it or not. Think of your medication as one member of a team, and your diet as another. If the team is not working together properly, problems can develop. Here is the action plan. Read the information that comes with your medication. Review possible food interactions with your healthcare provider or pharmacist. Ask your pharmacist for a medication review at least once a year. Keep an updated list of all medications and supplements you take. Finally, monitor your blood pressure regularly and report unusual changes to your doctor. For many seniors, this simple knowledge becomes a true eye-opening moment. If there is one message I hope you remember from this video, it is this: do not focus only on the pill. Blood pressure medication is an important tool, but it is only one part of the picture. Think of managing blood pressure like keeping a car running smoothly. The engine may be the most important part, but it still needs fuel, oil, tires, and regular maintenance. In the same way, your medication works best when it is supported by healthy daily habits. Hydration matters because your body needs enough fluid to keep blood moving properly. Timing matters because taking medication consistently helps create steadier blood pressure control. Movement matters because even light activity helps support healthy circulation. Sleep matters because poor sleep can place extra stress on the heart and blood vessels. Monitoring matters because it helps you spot changes before they become bigger problems. Many people believe that once they take their medication, their job is done. But small daily habits can have a powerful effect on how well treatment works. Missing water, skipping sleep, taking medication at different times, or ignoring new symptoms can make blood pressure harder to control, even when you never miss a dose. The goal is not simply to take a pill every day. The real goal is to achieve safer, steadier blood pressure and to help you feel your best. When medication and healthy habits work together, they create a stronger foundation for long-term heart health, independence, and a better quality of life. As we bring everything together, notice the common thread behind every mistake we discussed. None of them were about the medication being bad or ineffective. Instead, they were about the small daily habits that can change how the medication works inside the body. Whether it was taking your medication at different times, not drinking enough water, standing up too quickly, ignoring swelling, mixing medications, overlooking fatigue, or missing food interactions, each issue can affect your results in ways that are easy to miss. The good news is that most side effects are manageable when they are recognized early. Your body often gives warning signs before a small problem becomes a bigger one. It is also important to remember that blood pressure medications save lives. They help reduce the risk of serious health problems such as heart attacks, strokes, and other complications linked to high blood pressure. When used correctly, they are among the most effective tools we have for protecting long-term heart health. Most importantly, this video is not a reason to stop taking your medication. It is not a reason to skip doctor appointments or make changes on your own. The purpose of this information is to help you use your medications more safely and more effectively. The more you understand how your treatment works, the better prepared you are to work with your healthcare team and get the best possible results. Before we finish, let's turn everything we covered today into a simple action plan you can remember and use. First, take your medication consistently. Try to take it at the same time each day unless your doctor gives you different instructions. Small changes in timing can sometimes affect how well your treatment works. Second, stay properly hydrated. Your body needs enough fluid to help maintain healthy circulation and reduce the risk of dizziness. If you have heart or kidney problems, follow the hydration plan recommended by your healthcare provider. Third, rise slowly when moving from a bed or chair. Give your body a few seconds to adjust before standing. This simple habit may help reduce dizziness and lower the risk of falls. Fourth, pay attention to warning signs such as swelling in the feet or ankles, frequent dizziness, or unusual fatigue. These symptoms do not always mean something serious is wrong, but they should not be ignored. Fifth, review your medications, supplements, and food interactions regularly. A quick conversation with your doctor or pharmacist can sometimes prevent problems before they start. If there is one lesson from today's video, it is that blood pressure control is not just about taking a pill. It is about helping that medication work as safely and effectively as possible through smart daily habits. If you found this helpful, subscribe for more simple health tips designed specifically for adults over 60 and the family members who care for them. We share practical information that can help you stay healthier, safer, and more confident in managing your health. And remember, this video is for educational purposes only and is not personal medical advice. Always consult your healthcare provider before changing any medication, diet, or treatment plan. Thank you for watching, and I look forward to seeing you in the next video.